Hi, my name is Jacobson. I'm doing a role play demonstration video on how to start an IV on a live patient. Some objectives that I'm going to cover are reasons for starting an IV, the different catheter sizes or gauges that go along with the color, and then a taping technique once the IV is inserted and how to secure it. I'm going to cover the HANDS acronym, which is evidence-based practice on best ways of starting an IV and minimizing infection. So as I come in, I'm going to introduce myself to the patient. Hi, my name is Carrie. I'm a nurse. I'm here to start your IV today. Is that okay?
Yes.
Okay. Can you verify your name and birth date for me?
My name is Brad and my date of birth is May 21st.
Excellent. Okay. So the HANDS acronym, the H stands for hand hygiene. You want to clean your hands for at least 30 seconds. For time purposes, I have just washed my hands for the video. The A is antiseptic, so I'm going to clean the site very well. N is non-touch. Once the site is cleaned, you should not touch it or repalpate, and if you do, then you should re-clean it again. Once the IV is inserted, D stands for your daily inspection. You want to inspect the site at least every day, if not every shift. Make sure that it's not becoming red, inflamed, tender, or infected. And then S is scrub the hub, which you should scrub the hub for at least 15 seconds with either a chlorhexidine or alcohol-based product to make sure that it's clean before you utilize it, giving any medications or IV fluids. So we're going to start by putting a tourniquet on here. Sorry. Okay. I'm going to palpate and find a nice vein. There happens to be one right there. One thing I'm going to show you here, these are the different size gauges. Now, the bigger the number, the smaller the catheter. So I have a 24, which is a yellow, a 22 is a blue, 20 gauge is a pink, 18 is green, 14 is orange, and 16 is a gray. So like I said, the smaller the number, the bigger the catheter, the bigger the number, the smaller the catheter. So for purposes of this video, I'm going to utilize a 20. Normally I would go larger in a patient, but I'm going to do that today. Going to clean the site with my chlorhexidine. Make sure I find that site again here. Okay.
Before you poke me too, you should know that I have hepatitis C.
Okay. I appreciate you telling me that. My standard precautions here are going to cover any contamination that might possibly happen, but I do appreciate you letting me know that.
Okay.
A few things that I have set up is I've taken my saline flush, attached tubing to it, and then I'm going to lock it to make sure that I don't get any air in my tubing. What this is nice for is you're not having to manipulate the IV when you're connecting fluids. You can do it right at the end here. So I have that ready. I'm going to get my tape ready. I'm going to split that piece in half, put it on the edge of my tail here. And then I also have a tegaderm too, which I can utilize for securing. So now my area is clean. I'm not going to touch it again. I'm going to take my catheter, making sure that the bevel side is up as I poke the patient. Alright. I'm going to pull the skin back slightly as I insert. Ready? Okay, here comes a big poke. I'm going to advance the catheter, pull back. Okay, I'm going to release my tourniquet because now I have flush in my site here. I'm going to get my tubing ready. So that as I pull the needle part out, does that go back? Holding.
Mm-hmm.
And I can connect my lock in place. There's a little bit of a mess there. I'm going to clean that up because anytime you have blood, that's just a risk for infection. going to open my lock, flush, lock again, disconnect. Now I'm going to tape. What I'm going to do is called the chevron method. I'm going to go underneath the IV and help secure it. I'm going to put another piece over the top. Oh, I'm way further over. And I'm going to secure it. So now I have access. I can flush the IV. I can give medications through there. I can give fluids through there. I've shown you which colors and which gauges go with which catheters, which ones you decide to use. And then the taping technique, like I said, I showed you the chevron method that we would utilize for taping this. Thank you.